Since I do not have a proper patient for a breast assessment, what I will be using today is my mannequin. So the first step is to perform hand hygiene. You can do hand hygiene in three ways. You can use soap and water, like rubbing alcohol, or hand sanitizer. Today we'll be using rubbing alcohol. And after that, I'll be introducing myself to the client and then explaining what will I be doing to the client. So let's pretend that my mannequin is an actual human. Good afternoon, ma'am. I am Jemima Banyares. I am a student nurse from Benguet State University. Today, I will be performing a breast assessment on you. So, what I will be doing is, later on, I will be asking you to remove your top and your bra for me to be able to have better access to your breasts for the assessment. What I will be doing is, I will be palpating your breast. I will be inspecting them, meaning I will be touching your breast, and if you are feeling uncomfortable during the examination, please let me know so I may provide you space and time for you to be able to compose yourself po. So, let us start na po with the breast examination. Okay, so since I am working with a mannequin and not a real human being, I will be proceeding with the assessment with the assumption that this is a real human being. However, some of the procedures are really not applicable to the mannequin, and I will be skipping over a few of the procedures in the breast assessment. So the first step is to divide each breast into 4 quadrants, just like what we did in the abdominal assessment. So the 4 quadrants will start from the top of the breast going down to the underbust, and then right across, with the center being the nipple. This should be approximately where the nipple should be on an actual human breast. So what we will note for in each breast is the size and symmetry, the skin color and venous patterns, the shape of breast, if there are any masses or retraction of tissue or flattening of the breast. So as we can see, the breast of the patient is symmetrical and the size is the same on both sides. The color is consistent with the rest of the patient's body, and so far we cannot see any visible masses, and there are also no venous patterns, and so far there is no retraction of tissue or flattening of the breast. And then next is we will be noting for the position of breast and nipple, and this is a procedure that I cannot really perform properly as the rest of a mannequin is completely fixed, and it's difficult for me to describe it as it's not nearly as similar as to a human breast is. So let us just assume that it is in under a normal category of breasts. So next is we will be inspecting the color, shape, size of the areola. Now, the areola should typically be in this area, and the areola is the dark pigmented skin surrounding the nipple. And assuming that this is a normal woman's breast, it should be nearly the same size and the color should be similar too, and the shape should be nearly the same size also. And then the next is we should be able to note beside the direction in which the nipple is pointing. However, there is no nipple on my mannequin, so it cannot be an applicable procedure right now. And can assume that there are no presence of rashes or ulcerations and any discharge coming from the patient's nipples. So the next will be we will be palpating the axillary lymph nodes by having the client sit with arms at side and face client and stand on side being examined, and support client's arms while abducting that arm away from the client. So I will be showing this on myself. I'll be doing it as the client. My mannequin does not have any arms of their own. So I will be demonstrating what this might look like on a real human. So if you will be palpating for the axillary lymph nodes for the breast assessment, what you will do is you will abduct the client's arm away from their chest, so meaning it's pointing away. What you will do is you will start to palpate for the lymph nodes on here, and then you will be going down to the axilla, going down to the pectoralis major here at your side. Then you will be going to the edge of the latissimus dorsi. Then you do this again at the other side of the patient. So far, I cannot paint any of the axillary lymph nodes of my body, as so my sweater is thicker than usual. So we will be going back to the mannequin. Okay, so now that we're back to the mannequin, let's pretend that this is the clavicle of the patient. This is the area where the clavicle of the patient is. So we will be palpating the upper and lower clavicular ridges where there are lymph nodes located. So what we will do is we will place our hand here and we will press and feel if the lymph node is inflamed. If the lymph node is inflamed, that is the only time when you will be able to feel it. So we put our hand here and then press. If we feel anything there, then that means the lymph node is inflamed. That is not normal. And then we will be placing it also underneath the clavicular ridge and palpate. If we feel that there is an inflamed lymph node, then we should take that down in our notes. So the next procedure is for us to position the client in a supine position. So I will just be laying down my mannequin again, just like what I did in the first part of the video. Okay, so once the client is put in a comfortable supine position, we will ask the client if he or she feels any pain or discomfort. This is because we want to palpate the area of the breast which is not tender or painful to the client, so we know what it feels like for so that we know what a normal breast tissue feels like for this person. Okay, after establishing where the painful or tender areas are, if there are any, we will then proceed to the palpation. There are three techniques in palpating breast. There is the first is wedge, second is vertical strip, and then the third is circular motion. So I will be demonstrating the three techniques in breast palpation. Okay, so the first technique I will be demonstrating is the wedge. So this is the half of the breast. So how you will perform the wedge is you start at the nipple going outward from the center, going outward, and then the next palpation technique is the vertical strip. So what we will be doing there is pretend that there are imaginary lines across the breast. So what we'll be doing is imagine that that it's similar to what a snake would look like if they are moving. That is similar to the motion of the of your hand if you are doing a vertical strip type of breast palpation. So the next technique is a circle. So you will be starting from the outmost part of the breast, which is estimated to be around here for this mannequin, and you go in a circular motion going from the outer part of the breast to the middle portion of the breast. So if you happen to palpate a lump or a mass, is what you should take note of is its mobility, its size in centimeters, and its location relative to the breast. So the next one is okay. So that we will also do what we did on this side to the other side. So we will first start with the wedge type of breast palpation, starting from the center of the breast going outward, and then next is the vertical strip type of palpation, and then lastly is the circular type of palpation. So just like what I said before, if there are masses, note the location relative to the quadrant, and then next is mobility, size in centimeters, and the shape of the mass. Okay, so the last step for the breast assessment is you will be using our thumb and our index finger to pinch the nipple and check if there are any discharges. And since there is no nipple on my mannequin, we will just assume that once I pinch the mannequin's nipple, there is no discharge that is coming out, and really as what I did earlier, what you did on this side, you will do it on the other side, and after repeating everything on the other side is we will help the client in a comfortable position. Then afterwards we will be performing hand hygiene and record all findings in our nurse's notes. So that is the end of the breast assessment.